I'll be welcoming all the participants right now. I'll start the webinar. Welcome to all the participants. We'll just give a minute to let everyone join. Good afternoon, good morning, good evening to everyone. We welcome you, particularly those of you joining from far away or at late or early times. Thank you for joining this WHO EPI-WIN webinar on mass gatherings, safe gatherings, addressing challenges in religious events. This is the second of the series on mass gatherings and safe gatherings. We'll have a slight change in agenda. Before the other announcements, I would like to request Dr. Nedret Emiroglu, Director of Health Emergency Core Capacities at WHO, to welcome you all. Over to you, Nedret.
Thank you very much, Supriya, and good morning, good afternoon, good evening to all of you who are joining us today. It's really a pleasure to welcome you, as Supriya mentioned, to the second in a series of informing you and allowing experience sharing, knowledge sharing, and building upon those good knowledge and experience on the mass gatherings. Today is going to focus on addressing the challenges and getting prepared in religious events. We pay special attention to it because those religious gatherings unite millions of peoples worldwide, fostering faith and the communities, and we would like this to be happening in a healthy environment with the minimum risks. So ensuring the safety requires a careful planning and also a strong health systems, as well as the emergency capabilities to be able to alert, detect, verify any event. And of course, it's an area that requires collaboration among different stakeholders to protect both the attendees and the host community. So it really requires a community-wide, nationwide, broad engagement of various stakeholders with the organizing committees. And WHO has been already engaged in providing that support to the countries at the global phase on big events. So what we have been doing, and I'm happy to see that you will hear from 4 very strong countries hosting these kind of gatherings for a long time, whom we have worked together, and I would like to thank them for this collaboration, and at the same time has accumulated a lot of knowledge and experience that we are also using together. The Saudi Arabia, Italy, India, and Mexico is going to be sharing their lessons. But what is critical throughout the process is being prepared and conveying these gatherings in a healthy environment. And this is about safeguarding lives. This is about mitigating the risk. And this is about enhancing emergency response if anything happens. And meanwhile, the taking care of the attendees is going to require a strong health system which is resilient and also capable of delivering the routine services without disruption. And religious leaders and faith-based organizations, of course, play a key role in this process together with the hosting countries or communities, as well as the also as well as the organizing institution. And as trusted voices, they help communicate the risks, promote health measures, as well as bridge the gap between the public health guidance and cultural practices. So their involvement from the early planning stage will strengthen the preparedness and will ensure greater acceptance of the health measures when they are needed. WHO is dedicated to work with all the stakeholders, either the governments, the engaging organizations, religious leaders, communities, the relevant networks, and partnering with the public health institutions to strengthen this preparedness and response efforts prior to, during, and after the religious events. There's a period of focusing on different actions at each stage. And our goal is to build a resilient health system. So we advocate a risk-based approach focused on surveillance, evaluation, mitigation, and also a clear communication to ensure timely and effective responses. So as I mentioned, the esteemed speakers for 4 countries is going to share the lessons learned and their experiences, knowledge, which they have been doing actually throughout the years. And I have to thank them once more for this cumulated knowledge sharing, which we have been using in various platforms. And this is another opportunity for this knowledge and the experience to be shared, and which is going to, I hope, lead to stronger collaboration. Please engage actively during the webinar, and please contribute to our shared goal of making religious mass gatherings healthy and safe. So wishing you a fruitful discussion, and thank you very much. Back to Supriya.
Thank you very much, Nadret, for the welcome remarks, and thank you for joining us in spite of having many other commitments. We really appreciate that. Now, as Nadret said, we'd like everyone to participate in this webinar. We'd love to hear from you. And for those of you who are new to EPI-WIN, let me many of you, of course, are old friends by now, but for those who are new, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science and knowledge in accessible, understandable, and relevant ways for evidence-informed decisions and actions in health emergencies by all. Today, we have a great panel to share with you the process by which WHO and countries work to share safe health during mass gatherings for religious events. We have very distinguished speakers from 4 countries. First of all, Dr. Ninglang Wang, who's the unit head for mass gatherings and border health in WHO, will provide a short overview of WHO key resources for mass gatherings. After that, we have representative speakers from 4 countries. We're honored to have Professor Anas Khan, Director General of GCMGM in the Ministry of Health in Saudi Arabia, who will talk about the experience of Hajj and Umrah, which is well known, of course, across the world as the major pilgrimage. Then we have Dr. Martina Del Manso of the Italian National Institute of Health, who will share the experience of Jubilee 2025, which is this year. It's a jubilee in the Catholic Church for the Holy Year, and it's mainly in Rome and the Vatican City, but also across Italy. We then have Dr. Tanzit Dikit, Joint Director of Epidemiology at the National Center for Disease Control in India, talking about the Kumbh Mela, which is a major Hindu festival and one of the largest mass gatherings in the world. And finally, but not least, we have another extremely distinguished speaker, Dr. Miguel Lezana, Director General of Epidemiology at the Undersecretariat for Health Policies and Population Well-being in Mexico's Ministry of Health. So I will soon hand over the floor with them, but we would really like to start off with hearing from you, um, the participants. So, without further ado, I would like to invite you to give your views. Please join us at slido.com, hashtag 4178991. That's slido.com, hashtags 4178991. We'd like to hear from you and hear about whether you have been involved in health planning for a major event, particularly a major religious event. Well, most of you have multiple times. That's great to know. So do feel free to share your experiences on the chat. But if you have questions, please put it on the Q&A. Slido.com, hashtag 4178991. Great. So it looks almost half of you have been involved in health planning for major events multiple times. That's really great to know. I will leave the Slido on, so please feel free to go to slido.com and put in your inputs. But for now, we will move on, and I will invite Dr. Ninglang Wang to share an overview of WHO resources. I'd just like to also let you know that this webinar is being recorded and the recording will be shared. It's also being live streamed on YouTube in the YouTube EPI-WIN channel, and you can also watch it there later on. We will share the presentations with agreement from the speakers after the webinar. And finally, please keep your questions in the Q&A box, not the chat, so that we can keep track of it. But please do share your comments and experiences in the chat. This is for everyone to share experiences. We'd love to hear from you. And finally, please keep your comments respectful and to the topic. We would really appreciate this to be a serious discussion. And with that, over to Ninglan. Welcome to Ninglan, Unit Head, Board Mass Gatherings for WHO.
Thank you very much, Supriya, and good morning, good afternoon, good evening, wherever you are. Thank you so much, colleagues and friends, for taking your time to join the webinar. So as we said, this is a series of mass gathering related webinars. Just last month, we had our dedicated session for sports games. So we underscored the critical importance of house planning. Now, today we're talking about the religious events, which also underscore the importance of house planning as well, the robust preparedness. However, with added layer of complexities because the religious events require deeper contextual sensitivity, inclusive engagement with faith actors and community networks, and often community-based public house approach. So I'm sure you will be inspired by the four speakers. Now, as a dedicated team in WHO for this topic, for mass gatherings, our goal is really to ensure that the public health planning is embedded in all types of mass gathering events, including the religious events. So before we dive into the country presentations, I would like to take a moment to walk you through, WHO's role in the mass gathering. So next slide, please. Thank you. The mass gathering is the intersection of health security, society, community, and many technical thematic areas. So that speaks very well. The health risk management in the context of mass gathering is not the sole responsibility of the public health sector. Every agency involved in the mass gathering events should really integrate a public health lens into their planning. So the health considerations could be woven into every aspect of mass gathering. For WHO, our key role is to provide the technical guidance and support to the host nations, communities, and organizers. We do not make any decision or take any action on behalf of the host nation communities and organizers. Now, in terms of the planning, what we recommend is to conduct a strategic risk assessment to kickstart the whole process. So you will see at the bottom, we highlighted two documents, the first one is the WHO Executive Board paper, which really scope the task and WHO's mandate and WHO support for in this area of work. Next slide, please. I would like to speak a few more words on the strategic risk assessment, which is a risk-based approach for the risk management. That process is comprised of three elements in risk evaluation, mitigation, and communication. To start with, the risk evaluation is the starting point. It's about identifying and quantifying the baseline risks associated with a specific event. Everything from communicable disease, the environmental considerations, for instance, heat wave, the crowd management. So we assess the likelihood and the impact of the different scenarios based on the context, based on the population characteristics, the settings, and so on. So it will help us to know what we are up against. And now, once we understand the risks, we focus on reducing the risks. So that involves the designing and the implementation of any proportional and evidence-informed public health measures and to reduce this baseline risks. So this can range from, for instance, vaccination campaign to improve the hygiene and the sanitation, medical service, the crowd management. So the key is really to be proactive and to be practical and proportional. Now, finally, no matter how solid this risk management plan is, we need to, convey that message to the end users. So otherwise, it won't work. So the risk communication is a bridge between the policy and the attendees and the communities. So it's about the timely and transparent and culturally appropriate messaging to explain why we are doing what we are doing and why we're doing because only if the attendees and communities understand the rationale, they will be included in the process, and then that will increase the adherence and reduce the room for misinformation. Next slide, please. So WHO has a overarching support package. If you click that, yeah, to show the rest of the slides. Thank you. This is definitely not our full list of WHO support, but only some examples. So just wanted to inform that WHO support covers the different phases of mass gathering, the prior to mass gathering and during the events and post events. So our support is mainly around the conducting strategic risk assessment, supporting the countries, communities, and event organizers for testing their contingency planning by simulation exercise, looking for that networking partnership for inclusive management of the public health risks, enhance the event-based surveillance and building capacity, so on and so forth. And during the events, through the event-based surveillance, we support the evaluating the signals and the data to make sure that the decision making is timely and proportional to the public health risk level. And if the events escalate, WHO also on standby to provide any emergency response support. Now, throughout the public health, the mass gathering planning, public health planning, we also supporting the legacy building, meaning documenting the successful stories or the challenges for future improvement and success. So that could benefit to the host nations and to the other the future events. Next slide, please. Last but not the least, there's some resources from WHO to support the mass gathering planning. So we have this comprehensive document, which is the key considerations for mass gathering. This is a very comprehensive document touching upon all the public health aspects for the mass gathering. The second edition right now is being in the process of updating with the support of our collaborating center, which is led by Professor Anas, and he's one of the speakers, and then other collaborating centers and the expert network, and with our regional offices and the country contributions. There's a strategic risk assessment tool, and then WHO Global Mass Gathering Intelligence platform, which overlays the data from the disease outbreak news, the event place, the capacity building that from the public domain. There are also several guidance underway. One is the tailored event-based surveillance. The other is RCCE document for mass gathering contact and simulation exercise and the AAR. There's also a website dedicated for mass gathering. So we will keep you updated once those guidance are published. So I will not use more of time, so you can enjoy the presentations from the speakers. Thank you very much, and back to you, Supriya. Thank you.
Thank you very much, Ninglan, for that overview. I would now like to move on to the country experience sharing. And to start with, I'd like to invite Professor Anas Khan to talk about his country's experience with Hajj and Umrah. Over to you, Professor Khan.
Thank you, really appreciate it. And thank you, everyone. It will be my pleasure to present about the experience. And if you kindly confirm that it's showing properly. Okay.
It's showing,
So,
it's showing. Over to you.
Thank you. So, if I may start, I'll try to delve into this very complex, diverse experience in few minutes. We'll stay on a high level and hover around, and then we can, according to questions or follow-up, we can go into more details. So, the Ministry of Health, it hosts the Global Center for Mass Gatherings Medicine. It was established in 2012, and it's been a collaborating center with the WHO in the field of mass gatherings medicine since. We're proud of this collaboration, sharing experience and building knowledge. So mass gathering in general, this is the second round, but this round it's about the religious events and how it is unique and why we approach it in a different way, because the risks are different, the characteristic components of these mass gatherings are different, and the most things we need to highlight on is how the planning and governance is being conducted. What are the public health measures taken? The comprehensive urgent care service being designed and delivered. The emergency preparedness overall for major emergencies, how it's designed. And in the same time, what are the research development and innovation ongoing, especially in recurrent events where the accumulation of knowledge, the building of content about how to manage these events, the experience, it all has to accumulate and build together and to reach a better system overall preparedness and delivery of services. It's a unique situation in Hajj. So we say Hajj and Umrah. Hajj is a more complex ritual. It takes place only in a few days in a year, and it's being done in two sites in Mecca mainly. They have to go through the miqat, and then when they reach the Grand Mosque, they will do their rituals. They move to another holy sites. They will do some rituals there, moving around in certain times windows, and then they come back, and then they are officially completed their journey and ritual. Some of them might extend their stay before and after and visit other sites as well. Umrah is a much shorter. It can be done anytime throughout the year. It only takes a couple of hours instead of few days as in Hajj. Nowadays, it's Ramadan, toward the end of Ramadan month. So the numbers of Umrah, it's much heightened and it's becoming further more and more. Usually the numbers for Umrah, it's around 35 million through annually, and which are around half and half internal or external pilgrims. For Hajj, it's around, since post-COVID, it's been 1.8 million, and it's getting back to higher number due to international participation. Before that, it was around 2.4 million. On the left, we need to analyze the overall population, the social determinants of health of the people who are attending. So usually what we have is 1.7 billion Muslims population, 6% who are over 60. The population overall internationally has its characteristics of in terms of literacy and overall social health determinants. On the other hand, then after that, when we say on the right, the characteristics of Hajj usually that we analyze throughout every year. So we have around, as I mentioned, 2 million. They come from 184 countries, so different languages, cultures, backgrounds, everything. 37% have chronic diseases, above 60, and two-thirds of them have comorbidities. So this adds to the burden. And as a religious event, usually it's a participation. They're not attendance. So it means they will have higher risk. In religious events, because of the acts of devotion, they will tend to engage in higher risky behaviors. So all of these has to be considered on planning religious events. For us, the mission is to keep the healthy pilgrims participants in a healthy journey. What we usually do is the contextual analysis, as we just stated quickly, and the risk management. And we utilize different tools. We start with what we call JIDDA tool. It's a scientific strategic risk assessment tool that we have designed with the participation of the WHO and international figures in the field, where we will do the assessment for the risks overall and do the full cycle as stated by Dr. Wang on risk management and risk assessment. We also engage heavily with the stakeholders, the multi-sector collaboration. Eventually, such complex and diverse and huge event cannot be done with extensive and deep-rooted collaboration. We do the full C4 of the communication activities. We do lots of exercising and workforce training, as well as continuous evaluation, knowledge transfer, and legacy building. Legacy is a huge part of this, especially that we have this event as huge and annual. So we make sure that whatever investment we're doing, it will build and invest toward the coming years. and towards the overall system as well. So there is communication and community engagement as stated. We get every signal and respond to it. We do the full surveillance. We have the health early warning system, which will pick up any trigger, and then from there passively throughout all the integrated electronic health records in the area. And we respond to each trigger and make sure that if anything is building up, we will respond to it early on. With our rapid response team, we have very highly customized and trained on infection prevention and control measures. We do many activities in the environmental health, food and water safety, because of the situation where people are moving a lot in a hot area and hot areas. So to avoid all of the negative impacts, and the planning cycle, usually it's continuous. We have devoted departments, not one or two, many departments which are designated only for Hajj and Umrah services. We do it either strategic, operational, support. We make sure that every input is being considered at some point in the timeline. And the preparation for the coming Hajj starts immediately before toward the end of the previous Hajj. So it's a continuous cycle, and we make sure that we capture every lessons learned in our debriefings and continuous meetings. So we have also developed recently what we call Hajj model of care. But before that, just to explain some about our readiness, the resources in the area, which are we call the holy sites. Usually it's deserted throughout the year. It's a tent city, but there are 8 hospitals which becomes operational throughout the 2 weeks of Hajj, and more than 100 healthcare center. We have 18 point of entry that are fully equipped with preventive and urgent care services. In the holy sites and Mecca, we have more than 600 ambulances in addition to the mobile teams. We have the virtual hospital, which in Riyadh, extending its full services, and it's integrated in all centers. It's recently been the largest virtual hospital as per Guinness records. Also, overall, we dedicate more than 30,000 healthcare workers during this Hajj season. And we make sure that all our stocking and supply, the logistics chain is running smoothly and providing all needs with a full optimization of services in addition to the backups. Also, we invest a lot in the vector control interventions to make sure that no incoming vector-borne disease is taking place. So also for the urgent care services, we have in the last Hajj more than 160 healthcare consultations in the urgent care centers. We have more than 30,000 in the OPD specialized consultations in the 8 hospitals. We have more than 55,000 ER visits as well. The admissions were more than 9,000, and many hemodialysis sessions, endoscopies, open heart surgeries, and cardiac catheterization. So in Saudi Arabia, recently with the transformation, we came with the model of care and system of care, which has 6 phases and 6 layers. But we have customized these in Hajj to make sure that we are addressing the main needs. We are utilizing all data to make sure predicting what are the coming needs, what areas are to be prioritized, what services needs to have more investment or at least certain amount to match the resources and allocate appropriately. Also, we do lots of details about how the diagnosis and triage for the most common diseases happens and through different layers. The categories of the providers, we have the mobile teams, the health clinics or points, then we have advanced clinics and the hospitals. Also, from the other side, we have the flow of patients, the health system. So hundreds and hundreds of such pathways are being generated, and specialized pathways are being provided and trained for all healthcare workers. We want to make sure that we are providing the most appropriate in the right place and time due to all the challenges of the overcrowding that takes place in the area. So we need to reach for them immediately and to provide the service as soon as possible. Also, we are taking care of the competencies. So also recently we have uh, mi- included all our experience into coming of this competencies house. And also we have been investing heavily with the Hajj medical teams, where pilgrims sometimes they bring their own medical teams because they are used to their culture, know their language. So we are in the past it has been calculated. Now we are trying to make sure that there is an integration between the service and their continuity of care to make sure that there are appropriate interventions taking place. So that's in a nutshell. This is the recent recommendations done between us and the WHO in the last international conference for mass gatherings medicine conducted in Riyadh in late 2023. And before that, this is the model of care in mass gatherings. So usually we know that there is a huge interaction between the general public health system and measures and between the health security, where the main idea is to keep the international societies clear of any risk that could come out of these events. We have standards of cares, we have the curative services or the urgent care needs, where that service delivery is being conducted. And we hopefully that as well, the system overall, from an emergency point of view, is prepared to deal with major emergencies. The main thing, what we believe is legacy, that when you invest so much into these activities, that you will have the sustainability of these activities. Any efforts are being accounted for on the and lasting impact. And we're proud that our Hajj preparedness every year has been actively preparing us to deal with any other major events, either public health emergencies or other events. Recently, we have been doing in the Kingdom of Saudi Arabia many events, and it's being done very smoothly because of our experience, because of our exercises before, as well as if we are preparing for the coming years for the FIFA and before that for the Expo, the World Cup and Expo, both of them, when we reviewed uh, the requirements from a health sector for us, it's considered easily achievable, and we will do it hopefully and keep everyone safe. Thank you, everyone.
Thank you very much, Professor Anas Khan, for that very comprehensive overview and very clear. So that will be very helpful for everyone. I would now like to request Dr. Martinez to talk about the Jubilee 2025. And all participants, just to remind you, please put your questions in the Q&A so that our speakers can also look at them. And if you have comments, many of you have been involved in managing health events, please share your experiences in the chat. Thank you. Over to Dr. Martina Del Manzo.
Hello to everybody. I'm here to discuss measures and strategies for ensuring safe mass gatherings drawn for the preparation to Jubilee 2025. Is a year-round event organized by the Catholic Church in Rome and the Lazio region. Is expected to attract 36 million visitors globally and posing significant public health challenges at both regional and national level. In Italy, we have established robust surveillance systems that are routinely active to detect public health events. And these include indicator-based surveillance, that is, systems that monitor a list of notifiable diseases defined by law, coordinated by the Italian National Institute of Health. And the event-based surveillance, the same managed by the ISS and with the Italian Epidemic Intelligence Network active for 15 years with almost 50 analysts and the GSAGIR analyst network that ensure in this way both national and international monitoring. Both these systems are not specifically activated for the Jubilee, but are part of our ongoing public health infrastructure. The Lazio region, where the main event will take place, has developed a comprehensive plan to enhance disease surveillance during the Jubilee 2025. It is with key action that include to strengthen passive disease surveillance for respiratory pathogens, foodborne diseases, legionellosis, and vector-borne infections, to establish a dedicated regional unit for integrated surveillance management and alert creation, to expand the syndromic surveillance system and to implement wastewater surveillance, to create a risk assessment unit to support epidemiological investigation and response, and to train staff on reporting system and diagnosis, treatment, and control of infectious disease. The layered surveillance approach can be visualized as a matryoshka or nesting dolls, where each layer represents a different level of surveillance. At local level, the smallest doll, it represents local monitoring through integrated surveillance system for infectious disease. This level focus on detecting and managing public health events within the region. The national level, the next layer, include the nationwide event-based surveillance overseen by the ISS and the Italian Epidemic Intelligence Network. This level ensures comprehensive monitor across the entire country. And at the international level, the more external layer involves coordination with the international body, such as ACDC and WHO. And this level monitors public health events related to communicable disease occurring both within and outside Italy that may impact the mass gatherings. This nested approach ensures through and multi-tiered surveillance system, and it's capable of detecting and responding to public health events in various levels. So, to conclude, key activities for public health preparedness during this protracted mass gathering include prevention, surveillance and rapid alert, and response to alert. By implementing these strategies, we can ensure the safety and well-being of participants in mass gathering like Jubilee 2025. Thank you for your attention.
Thank you very much, Dr. Martina, for summarizing all the preparation for Jubilee 2025. It's a busy year for Italy this year.
Yes.
I would now like to invite from Italy, go to India. And very recently, Dr. Tanzil Dikit will explain to us about the Kumbh Mela, which was held recently in 2025. So over to you, Dr. Tanzil.
Thank you, Supriya. Can you see my slide?
Yes, thank you. It's working.
Okay. So thank you, everyone. Thank you, Supriya. Thank you, WHO. I'll be talking briefly about the recently concluded Prayagraj Mahakumbh Mela held in Prayagraj, India in 2025. So in terms of the event characteristic, before I talk about the public health preparedness, I would like to tell our audience a little bit about this event. So this is, as was mentioned earlier by colleagues from WHO, it is one of the world's largest mass gathering event. And this event takes place periodically every couple of years along the banks of holy rivers in India. And Prayagraj is a particularly important area in terms of the religious importance, because it is the confluence of considered as the confluence of three major rivers in India which are considered holy. And in 2025 it was showcased as a mega event of faith and culture, because of the belief that the astrological alignments came once in 100 years. So the site of this mega event is on a river floodplain, which is the size of about 5,000 football fields. And the duration of the event is 45 days. And two categories of visitors attend this event. There are those who are called Kalpvasis. They are long duration visitors who stay at the floodplain for several weeks to months. And then there are floating population of visitors who come to the event, to the river for a bath, and they go back essentially in 1 or 2 days. So long duration visitors and floating visitors. And there is a ritual of bathing in the river. And this year there were 5 major days of significance where, and on these days, people like to go en masse to bathe in the river Ganga. According to official statistics, more than 600 million visitors visited Mahakumbh this year. So to organize such a big mega event, administratively, it is extremely challenging. And the public health framework that is in place to organize this kind of an event is different from the routine. In India, public health structure is a federated structure, meaning that both the state government is the implementing agency and the union government at the center is an agency that provides support to the state government in terms of funding support, technical support, and so on. But the major implementation is done by the state health department. So to conduct this event, the state government notifies the area around which the Kumbh event takes place as a district. Typically, a district in India has a population of 5 million. So, anticipating the load of visitors, this area, this floodplain is notified as a district, and a temporary administrative structure is set up for the period of the Mela to implement all the different aspects of administration, including public health. The aspects of public health preparedness that were touched upon during Prayagraj Mahakumbh were public health and creation of a public health and medical infrastructure, augmentation of sanitation and vector control, disaster management, disease surveillance, coordination, and risk communication. And I'll touch upon some of these key aspects in my subsequent slides. So coming to the medical infrastructure, because the size of this event is so big in terms of its sheer numbers, the public health medical infrastructure has to be created from scratch to conduct this event. So this year, temporary health facilities, a total of 23 temporary health facilities were created at the Mela event, which comprises of one central hospital, which was 100 bedded, two zonal hospitals, sector hospital, first aid points with diagnostic labs. More than 150 free essential drugs were made available to the visitors. These health facilities, these temporary health facilities are then linked to permanent health facilities in the town of Prayagraj. So there were 4 government tertiary health facilities, and patient flow was linked to these 4 government tertiary hospitals, which had about a capacity of 5,000 patients. Additionally, to meet surge capacity, private hospitals were identified, green corridors were created for vast movement of ambulances. With regard to water and sanitation, piped drinking water was made available in this 4,000 hectare area. It's called a tent city because a tent city suddenly pops up for the period of 45 days. More than 45,000 toilets were erected, which had septic tanks, soap pit types. Sewage disposal facility was made available. More than 25,000 dustbins were made available, and 15,000 sanitation workers had to be deployed to take care of the augmented sanitation requirements. Water quality testing was done on site. For vector control, it started from the time of pre-event, during event, and after event. For pre-event, solid waste management system was created in the Mela area. All potential breeding sources were identified for decontamination. Chemical methods of breeding control were used in the temporary dwelling units that had come up. During the event, the vector surveillance um, uh, was augmented. Anti-larval and anti-adult measures were initiated, and early detection and treatment was strengthened in the health facilities that were created. Uh, Vector control continued during the post-event period, with vector surveillance continuing and chemical methods uh, of vector control methods continuing in the town of Prayagraj. So here in the photograph that I have put, I've tried to show newer methods of vector control machines that were being used. Instead of big fogging machines, portable mini fogging machines were adopted for use. Similarly, ultra low volume foggers were used, called mist blowers or cold foggers. For disease surveillance during the Prayagraj Mahakumbh, NCDC, along with the State Health Department, initiated a pilot disease surveillance program in 2019. And this program was extremely successful. And the 2025 disease surveillance platform was built on a legacy of the 2019 disease surveillance platform. And this year, the State Health Department uh, initiated and adopted this surveillance module. It was implemented by the State Health Department, while NCDC had a role in providing trainings and in conducting quality checks for the data that was flowing in and in verifying the events that were generated by the surveillance system. So 25 syndromes and disease conditions were being monitored, and the surveillance system looked at was an indicator-based surveillance system as well as an event-based surveillance system. And a special surveillance module was created on the national digital surveillance platform called the Integrated Health Information Portal. And here you can see this is the landing page of the Integrated Health Information Portal. And in this, there is a special module called the Mass Gathering module, which was activated during the Prayagraj Kumbh. Actually, it started much before the Kumbh because we wanted to generate baseline data as well. And training, monitoring, and event verification was done by NCDC officers. The actual implementation of the surveillance through the health facilities, the temporary health facilities that were created, was done by the state government, along with the augmentation of the existing outbreak-prone disease surveillance activity in the state, in the district of Prayagraj and the adjoining town. A community surveillance module was also activated for the first time. Here you can see this icon. People could scan this, and if they found any cluster of unusual illness, they could report it to the module. There were some innovations that were tried, piloted in this Mahakumbh. One such innovation that we piloted this year was environmental surveillance and respiratory disease monitoring. So we collected health condition data on acute exacerbation of respiratory illnesses such as chronic obstructive pulmonary disease, asthma, influenza-like illness, and then combined this data with the environmental data which was generated by the Ministry of Environment, and we tried to look at the correlation and the contribution of environmental pollution to exacerbation of respiratory illness. And This is some data that I have pulled out from the site, and this does show correlation. And right now, our teams are working on to look at more granular case-based data to quantify the effect of environmental pollutants on increased respiratory illnesses. In addition to this, India is in a tuberculosis elimination mode. So this event was utilized, leveraged to identify for new tuberculosis case detection. Screening for tuberculosis was done by the National Tuberculosis Elimination Program, and a total of 22 new cases were identified during the Kumbh period, and 15 of these people were from outside the district, and these were new cases that were identified, and all these cases were linked to Nixchai portal, which is essentially a portal that links the patients to treatment by giving them a Nixchai ID, and the treatment is free of cost provided by the government. And of the 22 cases, one case was an MDR case, and the median age was 45 years, and 86% were males. Nearly 1,200 TrueNAT tests were done, and 750 X-ray screenings were conducted during this tuberculosis camp. So, although I am making this presentation on behalf of the Ministry of Health, but this was such a big event that several agencies were involved, and these are my acknowledgements for all the agencies that worked towards a smooth conduct of Mahakumbh 2025. Thank you. Over to you, WHO.
Thank you very much, Dr. Tanzin, for that very comprehensive webinar, presentation that gives all the different aspects and a lot of work there. I now invite Dr. Miguel Lezana. Welcome, Dr. Lezana. I know you had a little bit of technical difficulties, so very glad to see you here. Over to you from Mexico's experience.
Thanks so much. Thanks for the invitation to our friends in WHO and everybody all over the world. If it's okay, I'm going to switch to Spanish. Is that okay for you?
Yes, that's fine. And to all participants, we have Spanish interpretation. If you go to the globe signal at the bottom of the Zoom and go to interpretation, please go and then click to the English icon there, and you can hear it in English if you like, for those who want to listen to it, the interpretation in English.
Okay.
Thank you.
Thank you. Thank you. Muchas gracias nuevamente por la invitación. Desde la Dirección General de Epidemiología, el Ministerio de Salud de México, les habla Miguel Ángel Lezana. La experiencia que tiene México en todo este tipo de fenómenos se inició hace ya bastante tiempo. De hecho, el primer gran evento de urgencia epidemiológica que tuvimos en las últimas décadas fue en los años 90 del siglo pasado, con la introducción del cólera en nuestro país. De entonces a la fecha, pues han sucedido distintas urgencias por la llegada de enfermedades emergentes o reemergentes, no solamente cólera, dengue, algunas otras. El impacto de los fenómenos hidrometeorológicos en nuestro país también ha dejado unas lecciones importantes, y desde luego las reuniones que están vinculadas con eventos religiosos. Next slide, please. El abordaje que se da es muy parecido a lo que sucede en otros países, en otros lugares. Tenemos desde luego una parte previa a lo que sucede, lo que son los eventos propiamente dicho, que incluye desde la supervisión del sitio donde se va a llevar a cabo el evento, identificar si es necesario tener algún tipo de albergue o algún tipo de lugar para atención de alguna urgencia, si es necesario todas las medidas para en su momento evacuar ante alguna contingencia la zona fuera de áreas de riesgo y desde luego también para este tipo de eventos pues se pone particular atención en lo que es el suministro de agua y alimentos que se requerirá durante el evento. Esto se hace desde la fase previa y posteriormente ya se lleva a cabo acciones que van desde la atención médica, la atención a la salud, acciones relacionadas con salud pública, dependiendo del sitio del evento, un trabajo intenso de comunicación, de riesgos, de promoción, de prevención y de control, si es necesario, por ejemplo, si se trata de un lugar en donde es común la presencia de vectores, transmisores de alguna enfermedad, de alguna arbovirosis. Next slide, please. Entonces, se busca un modelo de respuesta integrado. Básicamente, los dos pilares son, por un lado, la coordinación. Esto significa que se establecen comités de alto nivel y comandos, centros de comando de acción para coordinar toda la parte operativa. Tenemos entonces los comités que ven toda la parte de la estrategia y los comandos que operan las tácticas para la coordinación de las operaciones. Y desde luego, pues esto requiere recursos para atender tanto la fase preparatoria como durante el evento, las acciones que se deben llevar a cabo. Esto requiere, por supuesto, recursos humanos, recursos financieros y algún otro tipo de recursos para la fase de preparación y la atención. Los componentes, de manera simple, los podemos ver ahí. Está desde luego toda lo que es la protección contra riesgos sanitarios, es decir, tiene que ver con agua, tiene que ver con alimentos, etcétera. La prevención de accidentes que pueden ocurrir durante estas reuniones masivas por eventos religiosos, la atención médica y psicológica que tiene que estar lista para entrar a trabajar en el momento necesario, la promoción de la salud y la comunicación de riesgos, el apoyo de vigilancia epidemiológica durante el evento, complementado con vigilancia basada en el laboratorio de salud pública, toda la parte de comunicación social y, como ya decía, según el sitio de la reunión, si es necesario hacer algún control de vectores para prevenir enfermedades transmitidas por estos. Next slide, please. Next, please. Thank you. Entonces, el modelo operativo tiene en el centro la respuesta, que tiene que ser efectiva, tiene que ser inmediata y tiene que anticiparse en la medida de lo posible a la presencia de cualquier situación durante el evento. Esto se traduce en tener sistemas de alerta para la identificación de manera anticipada de necesidades y poblaciones en riesgo, así como el estatus de la infraestructura para la operación. La respuesta inmediata cuando se presenta alguna situación durante el evento, la parte de los comandos que ya decía yo, del sector, de todo el sector salud, de todas las instituciones. El sector salud en México es un sector muy complejo, muy segmentado, pero aquí hay una gran coordinación para poder atender desde cada institución la respuesta al evento. El diagnóstico situacional, siempre previendo desde la visión de la protección civil, la necesidad de instalación de albergues o el reconocimiento de las áreas geográficas, la atención a la salud a través de unidades centinelas, de la vigilancia, de la morbilidad y la interacción en distintos campos de la atención a la salud. Y finalmente, pues el componente de información, siempre es fundamental tener solamente la información que es necesaria, no ser necesariamente exhaustivos, pero sí estratégicos en la información que se va a recolectar, los momentos, las horas, los horarios, los días en que se hace el corte de la información, la parte del procesamiento, el análisis, la emisión de informes, la respuesta institucional para darle una retroalimentación. Después de cada evento, pues siempre aprendemos algo nuevo. Next slide, please. Entonces, las áreas de acción son las unidades de atención, los albergues temporales cuando es necesario establecerlos y las acciones a nivel comunitario. Y la cantidad de eventos que con este modelo atendemos cotidianamente, pues son desde luego todos los eventos relacionados con concentraciones por cuestiones religiosas, pero también eventos deportivos. Estamos en una fase muy intensa de preparación para recibir, junto con los otros dos países de América del Norte, Estados Unidos y Canadá, la Copa Mundial FIFA en el año próximo, 2026, pero también cuando tenemos brotes de enfermedades o desastres debidos a fenómenos disruptivos como puede ser hidrometeorológicos, huracanes, tormentas, geológicos, todo lo que es todo lo que son los distintos tipos de riesgos biológicos, etcétera, y las acciones que se deben que hacer con esto. Entonces, todo el modelo con las acciones y los componentes que ya hemos mencionado, pues se incluyen. En ocasiones, dependiendo del tipo de evento y la población, puede tener necesidad de revisar las coberturas de vacunación y si es necesario reforzarlas y la atención a los pacientes con enfermedades no transmisibles. Next slide, please. Thank you. Siempre el enfoque que se le da es un enfoque basado en los riesgos, sobre la ocurrencia de afectaciones a la salud de los asistentes a este tipo de eventos, de reuniones masivas, que tienen que ver con aspectos como el agua, el saneamiento, la infraestructura, por ejemplo, de energía eléctrica, los servicios de comunicación, tanto en tierra como remotos, decía yo, la parte de los albergues, en los servicios de salud y la infraestructura de salud, el equipamiento y los recursos de carácter médico que van a ser necesarios, los suministros para poder atender el asunto. Como el enfoque es basado en el riesgo, se buscan acciones que vayan encaminadas a ver el agua y los alimentos, si es una zona con algún problema de contaminación, cómo se van a dar los desplazamientos de la población, las densidades, cómo se van comportando las densidades poblacionales, sobre todo en áreas pequeñas, tratando de evitar el hacinamiento, ver si hay un problema en el área de fauna nociva, y si puede entonces ser una forma de transmisión de enfermedades. Next slide, please. Finalmente, estos son solamente algunos ejemplos de eventos religiosos. Dos de ellos son eventos que se llevan a cabo cada año en nuestro país. Hay movilizaciones que se dan por las peregrinaciones que desde distintos puntos de la ciudad del país llegan a la Ciudad de México, donde está ubicado el recinto más importante para los católicos en México, que es la Basílica de Guadalupe, de la Virgen de Guadalupe, que es muy visitado a lo largo del año a través de peregrinajes que vienen de distintos lugares. Entonces, esta es digamos, es una reunión masiva que está en movimiento, y entonces hay que hacer todo el acompañamiento durante el proceso, durante todo el traslado de los peregrinos. O eventos como es el día, el 12 de diciembre de cada año en México, se conmemora a la Virgen María de Guadalupe en la Ciudad de México, en lo que es el recinto principal de los católicos para esta festividad, y es un evento que reúne a millones de personas en un lapso de tiempo muy pequeño, muy concentrado, de una semana, 10 días, es que va pasando por este recinto, este santuario, va pasando entre 7 y 8 millones de personas. Y tenemos en ocasiones pues algunos eventos que son no anuales, sino que son ocasionales, como sucede con las visitas que recibe nuestro país de distintos papas de la fe romana católica, que también reúne a grandes concentraciones de población, generalmente en lugares abiertos para dar cabida a estas concentraciones masivas. Thank you very much for the opportunity to share the Mexican experience on the mass gathering related with religious events. Thanks so much, and back to you, WHO.
Thank you very much, Professor Lizana, for the experiences from Mexico. I will now hand over to Amaya to get some audience questions answered. My apologies, we're a bit over time, but I think there's some very good questions, so it would be great to have one or two questions from the audience that we can respond to. Over to you, Amaya.
Many thanks, Supriya, and thank you to all the speakers for the insightful presentations. We now open the floor, as you're saying, for questions and discussions. So if something during the presentations got your attention or you have any questions, this is your opportunity to engage. So please feel free to submit your questions in the chat. And we'll do our best to answer as many as time allows. And I see that we already have several questions coming in. So thank you again for your engagement. And let's begin with a question for Dr. Anas Khan for the Kingdom of Saudi Arabia. It reads like this: Dr. Khan, Hajj welcomes millions of pilgrims annually. Could you walk us through how risk assessments are conducted ahead of the pilgrimage and how these assessments inform preparedness planning to safeguard public health during such a large-scale event? Thank you, and over to you, Mr. Khan.
Thank you, Amaya. So yes, as stated briefly during my presentation, sorry, there is an echo. Sorry. Yeah, so we utilize the JIDDA tool, which, as stated before, it's a scientific validated risk assessment strategic tool done in collaboration with WHO and international figures. So we do the full scale of deep analysis for each component of the health system. We quantify according to these measures, and we come up with a prioritization of all risks. So we do the full risk identification, the quantification, and then we have a log according to these priorities, and we start to target one by one each one of these risks, and we communicate with the risk owner, and we create a risk log and a project management on how to follow these risks. And we revise it every season, every year, if there is any update for any risks. So it's just like a platform. We have all these inputs continuously, and we have our dialogues with our partners within the whole health sector, whether it's inside the ministry or within the health sector or with our partners. Say, for example, the Ministry for Food and Agriculture, if there is a risk of a disease of a cattle in one of the nearby countries. So we want to make sure that we will not import any cattle from that country to make sure, or are there certain measures we can do to assure that the ones we have will be off of these risks. So it come across everything: infectious disease, non-communicable diseases, emergencies, One Health. Everything is being considered, and we do it throughout the journey. We utilize technology. We have a dedicated two EOCs, one inside Hajj and the other one in Riyadh, virtually as a backup. And there is a third one also in Mecca itself. where it have the full data set. We have full screens, rooms of real-time data, and we have continuously monitor them and see which ones within each category. And we do the green, yellow, red ones to make sure that as soon as we reach the yellow one, we intervene vigorously to make sure that we will solve it immediately. So this is our approach, and the tool is available online, either on our website or in the publications. If you just write JIT the tool, it will show up. And if one is interested and on our website, we have not only the publication, but also the file of the user manual, where it will detail, it have the details on how to utilize it.
Many thanks for your answer, Dr. Khan. Yes, and we already shared earlier the link to the JEDA tool, and there were some questions. There's quite a lot of questions for you regarding Hatch and Umbra, of course, and you touch upon technologies and real life data, so much appreciated your comprehensive question. The next one is for Dr. Tanzeen from India, and they ask about the challenges and legacies when addressing environmental concerns for the last Kumbh Mela. So over to you, Dr. Tanzeen. Thank you.
Thank you, Maya. So thank you for that question. That's a very important question. And regarding the challenges and the legacies, I think such a big mass gathering brings its challenges. And so if I restrict myself to the challenges related to delivery of public health, I think one of the biggest challenges is after the mass gathering, the sanitary and the ecological effects of aggregation of such a large number of humanity in a small area. And so to deal with that, the administration, the health department specifically works on strengthening the health system, increasing the health system resilience for waterborne diseases, vector-borne diseases, augmenting the surveillance system especially. So like I mentioned in my presentation also, the preparedness is not restricted to pre-event and event. Preparedness is also for the post-event, because these increase in vector-borne diseases, increase in waterborne diseases is anticipated after the event as well. Similarly, increases in respiratory diseases. In addition to the public health system, we also work with different ministries. We work with the Ministry of Environment for cleaning the Ganga. So that is an area that is taken up by the Ministry of Environment. So similarly, desiltation that happens in the floodplain area. So that is another anticipated challenge that is there, and the Ministry of Environment works on that. It's a whole of government approach. So yeah, thank you for the question.
And many thanks for the answer. And really important and key to emphasize, as you say, in preparedness is also about the post events and documenting all the legacies, and they need to work with the other stakeholders, such as the Ministry of Environment, for this specific event. So many thanks for that. The next question goes to Dr. Lezana from Mexico. So I will quickly read it in Spanish for you, Dr. Lezana. El Día de los Muertos and Virgen de Guadalupe, especialmente las celebraciones en torno a la Virgen de Guadalupe, están profundamente arraigadas en la tradición. ¿Cómo se aseguran de que los mensajes de salud pública sean culturalmente respetuosos y logren conectar con las comunidades durante estos eventos? Gracias, doctor Lezana. Tiene el audio el mute, doctor Lezana, no le podemos escuchar.
I'm sorry. Ok, efectivamente son dos eventos muy importantes que se celebran cada año, que tienen sus particularidades. La celebración de la Virgen de Guadalupe, básicamente lo que tenemos es una gran movilización de personas de muchos lugares de todo el país que llegan a la Ciudad de México, que es donde está el santuario de la Virgen de Guadalupe, solamente a visitar a la Virgen de Guadalupe, y después se regresan a sus lugares. Entonces es una gran movilización en un espacio de tiempo relativamente corto. El evento de Día de los Muertos, esto se celebra en México a principios del mes de noviembre. El día 2 de noviembre es el día que se celebra el Día de Muertos en México, en donde es muy distinto. La población se desplaza hacia los cementerios, que es donde se reúnen. Generalmente pasan ahí la noche del día 1 hasta el día 2 y están ahí, convive ahí la familia en el cementerio, arreglan tumbas y ese tipo de cosas. Entonces, tienen particularidades. Efectivamente, México es un país multicultural. Entonces, si bien es cierto que más del 80% de la población en México se autodefinen como católicos romanos, de todas maneras hay ciertos aspectos culturales que hay que tener mucho cuidado. Nosotros utilizamos para toda la estrategia de comunicación de riesgos en estos dos eventos personal que viene de distintas partes de la República Mexicana y que conoce mejor las identidades culturales de cada zona, de tal suerte que los mensajes, siendo homogéneos en cuanto al contenido, sean muy cuidadosos de respetar la multiculturalidad, que es una de las características muy típicas en nuestro país o que nos define como país, siendo muy respetuoso de la fe que profese cada persona, pero siempre buscando, como decía yo durante la presentación, enfocarnos en la identificación y la prevención de riesgos y en caso de que se materialice alguno, respuesta inmediata ante la situación. Pero sí, se toman todos los materiales que se hacen para comunicación, se toman en cuenta estos aspectos culturales para respetar las particularidades de las distintas regiones que componen nuestro país. Gracias, Ani. Sí.
Sí, muchísimas gracias, doctor Lozán. Muy importante esta experiencia de vuestra estrategia de comunicación de riesgos respetando la multiculturalidad. Así que gracias de nuevo y lo apuntamos también para futuros eventos. Y por
Gracias.
último, tenemos una pregunta the last question is for Dr. Bermanso from Italy, and it's about how do you coordinate with different stakeholders, including religious leaders, government agencies, and emergency services. Thank you, and over to you, Dr. Martina.
Okay, thank you for the question. I can say that actually we largely make use the coordination mechanism already in place, primarily activated in response to local or cross-regional infectious disease outbreaks. Summarizing, considering that Italy has a decentralized national health system, upon requests from regional public health authorities involved in management and response to outbreak, ISS provide scientific and technical support. We already activate and developed with region a series of preparedness simulation exercise, joint training in epidemic intelligence and after action review. And for the communication, we normally speak with the commissioner responsible for health-related technical coordination, just to be sure that effectively protocols and public health recommendations were implemented in the organization framework.
And many thanks for your answer, Dr. Martina, and very important. Again, we're seeing more and more the emphasis on the need of the simulation exercises when planning, as well as eventually after action reviews and documenting all the legacy. So I'm going to stop here with the Q&A, and I'm going to quickly hand over to Dr. Supriya. Thanks a lot.
Thank you very much, Amaya, and thank you to all the 4 speakers as well for answering the questions, and thanks to the participants. We're now coming to the end of our webinars. Can you hear me?
Dr. Supriya, loud and clear.
So we now come to the end of our webinar. I'd like to particularly thank the Mass Gatherings team for WHO for organizing this webinar. A huge thanks to all 4 speakers. Thank you to Dr. Ninglang Wang for leading this. And I'd also like to thank those who worked in the background here. From the EPI-WIN team, Dr. Lester Geroy, who was monitoring the chat, our WHO collaborating center colleagues from ECHO India, Kanika Sachdeva, Sangamitra Barua, Sana Anjum. And last but not least, a huge thanks to our participants, all of you, and we hope we'll see you next time in the next webinar, which will be on 2nd April. And I'm just sharing my screen here. We hope to see you then. Also to let you know that this is the second in a series of webinars on mass gatherings. So we will let you know about the next one very soon. We will announce it both on social media and through our EPI-WIN channels. We hope we can see you then. Thank you very much. And all the recordings and presentations will be shared with you and will be uploaded to our website. Thank you very much. And thank you to all the speakers once again. Bye.